Hi, I'm Jeremy Crosby.
And I'm Nick Boucher. We're your hosts for the program that's all about your city, Talking Fitchburg.
Every weekday, we pull together the news, events, and information you need to stay on top of what's happening in the city of Fitchburg.
Find Talking Fitchburg on cable TV, Roku, Amazon Fire, Apple TV, and our live stream on the web. Plus, you can find all our headlines and stories on Facebook, YouTube, and our video on demand service. This is your city.
Keep up with Talking Fitchburg and the issues affecting you and your neighbors.
Want to know what's happening in your city? Get Notify Me messages from the City of Fitchburg. Visit fitchburgwi.gov on your computer or mobile device and select the big Notify Me button on the left. Enter your email and/or phone number, whichever is best for you to get notifications. Scroll down the list and select all the topics you're interested in to receive email or text messages about. You'll be notified every time one of your topics is updated. Sign up for Notify Me, one more way to keep up with your Fitchburg government.
I'd like to call to order the September 18th, 2025 meeting of the Fitch-Rona EMS Commission. And next item, roll call.
Sure, I've got it. Michelle was unable to be here with us again tonight, so I'll take that for her. James Roberts.
Here.
Nicole Vafadari.
Here.
Jake Lepper.
Here.
Oh, he's here. Coming from the... Perfect. All right. Derek Johnson.
Here.
Patrick Lytle.
Here.
Stephen Fusco.
Here.
David Lonsdorf.
Here.
Deb Paul was not going to be here. Sue Luganbill was not going to be here. I am here. Chief Dostalik is finishing up a vacation. Chief Anders.
Here.
We do have a quorum.
Thank you. Is there any public comment to discuss this evening?
It wasn't public comment. I did get some questions from Sue, but we can talk about that later. I believe she emailed them out as well.
Perfect. Thanks. Moving to the fourth agenda item, review and approval of the meeting minutes from August 21st, 2025. Before we take motions, any questions, any comments about the minutes? Then let's go for motion to approve.
I'll make a motion to approve.
Second.
Second.
All in favor signify by saying aye.
Aye.
Anyone opposed? The motion passes. Chief's report.
Sure, thanks. I shared this with you, emailed it out. So as usual to note, I would say we're down for calls for last month, but it was still up in that 431. So we are on track for 8.9% over last year, looking at 5,600 calls for the year. Everything else stays pretty steady. We did bump up again, like I always like to point out the mutual aid required to date. So I think it was another 4 or 5 times last month where we did require the city of Madison or Middleton to come on in and cover our calls because all of our trucks were out. As you can see, it was 45 was our total for last year. And at the end of this last month, we're already up to 39. So we'll exceed that again. We'll exceed that this year. Some community events. School is back in session, so we did do a back to school event. Lane and Jonah helped with that. Back to Friday night football games. We did the cross country invitational, the big event on Saturday. First Saturday of the month, went off fairly uneventful. Have done our first kind of fall hands-only CPR class at the Fitchburg Library here. I think that was last Tuesday or the Tuesday before. Had a full house of 12 individuals show up. So love it when we get those at our libraries. Next Tuesday will be the one in Verona. And then we have them every month for the next 3 months in the fall. The rest of the statistics are there, what you normally see. Falls is, again, that number one thing we see. Aging reports are kind of where we anticipate them to be. As far as our cash on hand, again, you'll just see the layout there. That big amount that's reduced from savings. So the savings is actually where our FAP funding donations and grant funds sit in that savings account. So that was part of that FAP funding that you see coming out from the assigned fund balances below. And then our WISC account is doing well as well. No donations for this last month. Our September milestones, we have Brandon Ryan, who's been here for 14 years full-time, and then Desiree Heimbecker, who has been here for 3 years. She's one of our LTEs. I got a couple other updates here, but I'll hit the shout-outs first. We got actually a thank you card from a patient for Jeremy and Jamie Owen, thanking them for their care. And then we did get delivery of our new e-bikes that we got with our EPIC grant, which has kind of been a bit of a process. Chip took them out for I think their first spin and refers to them as a spicy ride. So that's actually kind of what we've been referring to them as. I took them out shortly thereafter as well. And if you don't have an e-bike, they're pretty slick.
They're so fun.
It's been pretty slick. So they're big beefy bikes, and yeah, I will concur with they're a spicy ride. But with that, we actually part of that package was actually getting new EMS bags for the back. So he spent a while trying to figure out 5-pound bag and a 6-pound bag, or vice versa, I think it was. So just a huge thank you to him to help us switching those over and getting those set up. We do have one more event we do with the Fitch-Rona PTO. It'll be the first weekend in October. I think October 4th. They do a 1K and 1 mile and a 5K around the school, and they ask that we help them every year with our bikes. So we will get them out yet this season to ride. Other updates that I have in here, just to share with you, reminder, and I'll say it again at the end of the meeting, is the annual meeting that we have with all the municipalities is next month. That's always the October meeting, so October 16th. I will send out the official notice that has to get sent out per the agreement. But if you can please take that back to your councils and town board. It will be here the third Thursday of the month at 7 p.m. If you've never attended that before, essentially it's just kind of a state of the state I try to give for council members in the town board, who sometimes I don't really know what we do, right? You're very involved with what we do here, but giving them an overview of where we're at with our, essentially I'll do that chief's report like I give to you every month, but give them that, looking a little bit retrospective, looking at what our future looks like, reviewing the budget that you've seen for a couple times, and then just really kind of that networking for the 3 municipalities together. So sharing that for next month would be very helpful. That's what I have for a chief's report.
Any questions for the chief? Thank you. Review and approval of accounts payable checks authorized by Chief Anderson. Sue had some questions.
Yeah, Sue had some questions that she did. She responded to everybody. I will do the quick reminder. I try not to send everybody emails, but if you do respond to an email, if you can just respond directly to me, because otherwise we end up with the whole walking quorum discussions thing via email. So I will do a better about blind seeing you all of it. But she actually had some questions on the expenditures. The report that you see, and I think I can... The one that gets emailed out that does it's referred to as the in-house version of the operational budget that shows expenditures through date. She did ask about the grant expenditures line items. Line items we added, I think I added those over the last couple of years. What was happening, at least for you, as you were seeing this every month, the grant expenditures, something like the bikes. All right, so the e-bikes were money that came from EPIC, but if I don't put them in grant expenditures, then they have to go in some other line item, and all of a sudden you see there's a medical equipment line item that's right 500% or 1,000% over normal expenditures. So I try to separate those out, and that's where the grant expenditures FAP CIP come from, so that you are aware that money is leaving the district, but that it's not actually kind of affecting that traditional operational budget. She asked about the patient reimbursements. You would have seen those black line items again on the check report this month. Historically, right when we had our previous billing company and kind of that transition, there was some issues with those reimbursements. Our new billing company, we were all set up, and then I will share we thought we were all set up. Right, Michelle, as much as she followed up and said we should be getting these reports about overpayments, they said yep, and they were not. So you'll see another big batch in there. Now we are set up correctly, but so every month, and the patient reimbursements tends to be maybe a patient pays, their primary insurance pays, they pay their copay because they're not completely familiar with their health insurance, so they'll be their secondary will pay, so we owe a refund to the insurance. You may see them to other insurance companies as well. That's a really good example of that is like a health insurance company will pay and then the auto insurance pay from a motor vehicle accident so that we owe that money back to the health insurance or back to a patient. So those are what those patient overpayments essentially come out to. She did ask about, I don't know that it's actually on here, but I think it was one of the line items 1 month in the check. There was a line item that said tariff. We do actually have had a couple pieces of medical equipment come in with specifically separated out on the bill from them as a tariff charge. Most other, right, as I can't explain it, I'm not a financial expert. Most of them are part of the purchase, but we've had at least two where that line item has been very specific.
Oftentimes, it's often because companies don't want their consumers to think that they're raising prices of things, so they're very explicitly calling out these are due to tariffs, not due to anything that we're paying. So I think it's more of like a company policy, not so much a difference there.
And so we largely haven't seen them. We just have had two companies very specifically put that on there. So kind of talking amongst ourselves, we decided to really just separate them out just cause. All right, so really they go in there somewhere else, but it's just kind of, I don't want to say fun fact. It's not at all fun fact, but just fact. So one of the things she had put, it was that as a very specific payment, and it's not. We truly just separated them out as far as a different line item. So those were the three questions she actually had about that in-house budget and the checks.
Thank you. Are there any other questions for the chief? I'll take a motion to approve then.
So moved.
Second, please.
Second.
All in favor signify by saying aye.
Aye.
Anyone opposed? The motion carries. Next up, Resolution 2025-7, approval of GASB 54.
Same thing we approve every month, right? Per to the auditors, there has to be so many dollars set aside each month that you have indicated that are truly assigned fund balances. The inventory, the prepaid expenses that we get from the auditor every year that don't ever change, and the only things I change in here then is that sick leave liability, which just continues to accrue interest every month, so that changes every month. And then this will be the first month you'll see we normally have that $24,000 pot that is used for contract negotiations that we keep at that $24,000 level. We are in contract negotiations and we're starting to see our first bills come through. So now you're going to see that actually go down here over the course of the end of the year, and then that money is budgeted for next year. But it refills essentially as early as next year, depending on how much we spend, or it will fill up over the course of the next 3 years as we fund that. That's what this is.
Any questions for the chief about Resolution 2025-7? Then we need a motion to approve.
I move to approve Resolution 2025-7, approval of GASB 54.
Thank you. Second, please.
Second.
All in favor signify by saying aye.
Aye.
Anyone opposed? The motion carries. Discussion possible action on policy update conditions of employment.
Sure. So I have another policy bringing in front of you this evening. Kind of like last month, it wasn't completely rewritten. I did hit the accept all changes because I was trying to fix it right and stop tracking it. So now I don't have the red line version to show you because it unredlined everything and made them permanent. I will hit the highlights for you. It was a couple of essentially wording maintenance things that we just had to adjust. Big one being just clarifying in that very first line that EMS providers, and we identified the different levels. We do have all 4 levels of EMS providers who work with us now. Our last 2 interns have joined us with just that first responder, that EMR. And then we do have one of our LTE EMTs is an AEMT, and then most of our paramedics. So we just added that in there to kind of help, right? Because these policy covers all the levers, levels. So just changed and updated that. We didn't touch anything with as far as licensure credentialing, the items that are required as far as the licensure part of things. That didn't change. The biggest change we looked at was the driver background and emergency vehicle operator course section. We actually looked at this about 5 years ago, kind of talked about some what would happen if, so one of the conditions of employment that we have is in part of the job description, and this policy itself is having a valid driver's license. As you can imagine, right, we run crews of 2, which means unless we have a serious patient and we have both providers need to be in back, in which case we'll have a firefighter, or if we're intercepting, they'll drive our ambulance. But traditionally, the large majority of the time, it's one of our providers and one of the other providers drives. They just switch back and forth on every other call, or however they work it out amongst themselves. So this is a challenge then if one of the providers loses their license. So as we were reviewing the policy, actually reached out to our insurance company, kind of some different options that were available. One of the questions that came up was an occupational license. Though you can have an occupational to drive to and from work, it's actually very business based on whether they will let you drive at work. The vast majority of them, to include our insurance carrier, does not recognize an occupational license to drive a department vehicle, right? So your license is suspended or revoked. It is suspended or revoked. So that actually changes kind of some things about our approach. So how that process originally was written when we looked at it about 4 or 5 years ago was that it could be up to 12 weeks. So about 2 months, about 3 months or so, where it was okay for you to be essentially your partner would drive you around for 3 months, right? But that means I want to get stuck in back, but you provide all the patient care. Not a bad thing, but that means your partner doesn't get to provide any patient care for 3 months, right? Kind of recognizing that could be a burden on a partner who does, right? They didn't sign on to this job because they wanted to drive. The original policy had that up to 3 months. And then after that 3 months up to 1 year, they would actually be put onto an unpaid leave. And then after a year, they could potentially face termination because of the inability to maintain a driver's license. Doing a little bit more research, there's a handful of potential options that have come out there for reasons to have your license suspended. Many of them, or a handful of them, are a minimum of 6 to 9 months. So the original policy we had in place would have put those people on an automatic leave of absence at 3 months and 1 day. Where one violation would actually results again in that automatic loss of six months. So worked with the union already, so they have seen this, or at least the union steward has seen this. So change the language here. I'll fix my spelling mistake, but fix some of this as well. The approach we took was that upon conviction, or I think it was conviction, or a court date, or conviction, or a plea of guilty, then they had to notify us when that occurred. Again, kind of some learning curves here. Your license can be suspended way before that court date. So actually had changed the language in here. We already do a driver's license abstract when employees get hired, and then we actually do them annually. Which we will continue to do, but we put some language in here that includes we may do them periodically throughout the year as well, just so that employees have that heads up, right? We aren't kind of restricted by policy to only doing those 2 times a year. Adding in that language, as I had mentioned, right, upon immediate notification of suspension or revocation, they have to let us know, because per our insurance company, they are no longer insured and are no longer allowed to drive our vehicles. So that is immediate versus the original language that said conviction. And then putting the description in here, right, if the employee does not meet our driving requirements or deemed uninsurable, here's the action we kind of worked with through the union. Because there's, again, a couple of the situations we worked through, as opposed to having the 3 situations that were 0 to 12 months, 12 months to 1 year, and 1 year and beyond. A couple of those examples were loss or suspension or revocation of license anywhere between 6 to 9 months. So we're back to being pigeonholed. Right? You draw the 9-month card because you made a bad mistake. You draw the 6-month card because your mistake wasn't quite as bad as somebody who drew the bad card, right? You fell somewhere in there. What we did here, and again, the union gets another kick at this after you look at it, but essentially put it in there of your assignment will be modified. So, right, potentially we can move them around. They wouldn't necessarily... We could move them stations, we could move them shifts, so it wouldn't be you're stuck with the same partner who's got to drive you around for the next 11 months and 29 days, right, for the duration of the suspension. So I moved that timeline on there. It does say, right, it does give us that out that said, if that's truly presenting a burden upon the district, or there's significant concerns, that we still have the option to put that employee on an unpaid administrative leave, right, not going to terminate them, but they aren't going to be working for 11 months and 29 days, right? It's still there. Then the third part of that is truly that after 1 year. So anything at 12 months or beyond, and it doesn't say termination, right? It says shall be, we have to go through the process of you're not employable here. We will work through that process, though, anything beyond 1 year, and it does say we can terminate you. And then the union, right, just asked that we keep them in the loop. I'm like, right, I would like to think we would do that anyways, but I have no problem putting it in here because that's what we do need to do. Caregiver background check, immunizations, documentation, and failure to comply, none of that changed. Right? So it's the same things that we had prior to that. Yeah. So the big thing was this insurability thing, got out those restrictive dates and made them put some more wiggle room in there. Questions?
Any questions for the chief about this?
I have a couple. So the first one, whenever I see the words reasonable efforts in a contract, as a human, I like it. And as a business owner, it makes me cringe. So has that been reviewed by a lawyer just to make sure that, like, whose definition of reasonable efforts, and is this something that is hopefully with reasonable people is very understandable, but
it is not. We can absolutely kick it to the labor attorney. Really, I think when we worked through this, we were, brought up a lot of past practice of we currently do not have light duty, and that has been kind of a standard for us. We just don't. Right. So I think that kind of. We absolutely can push this off to the labor attorney. But it makes it
more clear because it's like there's just fewer positions to help accommodate.
Yep.
Okay.
Yep.
Okay.
We can do that.
Gotcha. Thank you. And then my only other question was just a general curiosity around immunizations with current administration challenging CDC best practices of what immunizations are best practice and have been for many, many, many years. Is this able to be put in place based on our municipality and not overruled by, like, not to look in a crystal ball, but any federal changes of things? Like, is this under our withstanding to dictate? Do we know?
So when we arrived, we really visited that one 2019-ish and kicked it around. And we actually kicked it around a little bit before that. As of the snapshot of this, and I do not believe anything has changed, the only thing required by the state of Wisconsin is a measles vaccination.
Oh, interesting.
So beyond that, and that's why it included the language in there about documentation or waiver of those immunizations. It has to be on file.
Okay. So measles has to be, okay.
Measles is, right, and that's as of 6 years ago. So yeah, we haven't visited that again since then, but at the time, at least in the state of Wisconsin, that was the only thing that was required.
I think that's a good thing to keep an eye on. I just saw, actually, before driving over here, that the Florida. CDC, the federal guidelines have revoked and encouraged to minimize a combined MMR vaccine for children under 4, which is terrifying as a person who has a child under 4. But that is just applying to children. So maybe something just to like keep it. I didn't hear anything related to adults. So
Sure. I know there's a little bit of wiggle stuff in there too, being that we are a healthcare provider. I know
that's a
there's
good point.
some.
Yeah.
There's a little bit more leeway in there of healthcare providers being able to require this of our employees, based on the nature of the patients we see.
Thank you for that.
Are there other questions, comments? Patrick?
I guess, given the note about clearing the reasonable effort with the attorney, would you like us to approve this at the commission level, subject to attorney review of that language? Would that get you guys where you're hoping to get, and also still address the commissioner's concern?
I think that I think that will work. That starts at least that 21-day clock as with so part of our policy on policies, I like to call it. Upon approval of the commission, there's actually a 21-day input period by the union. If there are no concerns or questions brought up by the union, the policy goes into effect in 21 days. If there are issues brought up by the union, those comments and concerns come back to the commission for review, in which case you can include or deny and keep it standing as it is. As I had mentioned, there's a little bit of a time frame on this policy, so that would actually be very helpful if you're okay moving forward with that, that we will approach this. And so maybe approve this as it is here. We will do the research and come back potentially with any revisions, and it won't be in October. And that was part of the crunch as well, as October is the annual meeting, so we won't look at this now until November or December. So that was the long answer to your yes.
Sounded like yes. I'm going to go with yes.
I can't find the part that talks about reasonable efforts or something. Where is that in this?
Under assignment modification, the very first line item, the district will make reasonable efforts to modify scheduling and assignments to accommodate such duties.
Under number 1 of the 1, 2, 3, 4 list.
All right.
And again, part of that was, right, if your partner says, I think it's a true complaint of a partner if they said, I'm not driving you around for the next 11 months, right? That's not what I signed in for. This is the ability that, okay, but so now I'm going to move you stations, or I'm going to move you partners, and they can't come back and say, well, right, this is what I signed on for. I'm like, all right, let's work through this. But it's, to me, it also allows the union to come back and say, right, this person's situation may be presenting an undue burden on somebody else, right? So for me to have to change everybody's schedule, I'm like, that is an undue burden. But I completely get what you're saying, right? Maybe the union does say, right, you need to readjust their entire schedule for the next 11 months. And I'm going to tell you, I believe that's unreasonable. They will believe it's reasonable. And that's where we enter that gray area. So thank you.
So are we ready for motion then? So who would?
I liked Patrick's wording.
Patrick did great.
Okay, I'll make a motion to approve the policy as presented, contingent upon legal review of the reasonable efforts reference.
May I have a second?
Second.
All in favor signify by saying aye.
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 Is anyone opposed? The motion passes. Under other business as allowed by law, before you remind us about the annual district meeting, is there any update on contract negotiations that you can share?
We're still meeting. We're still meeting. So we've had 3 meetings so far. I think very similar to what I reported last month. We are close. I don't know that we're close enough. Well, we're not close enough. I've had, after the last conversation with our labor attorney, I have met with the city representatives as well. Last week, I have since talked with the union steward. It's kind of for him, he's going to talk with the union this week. The two of us are going to come connect together next week and kind of determine what our next steps are. So we're close.
Thank you. Do you want to remind us about the annual district meeting?
The annual district meeting next month, October 16th. I will put out the official notice that we have to do via the IGA. Again, in here, it's kind of a state of the state review. Snacks will be provided, whatever we got to do to bribe people to come. Yeah. That's all I got.
All right. Any other business?
I hope this falls under allowed by law. I'd seen an email that there were some tweaks to the 2026 budget. Do those have to come back to this body, or is that enough of a administrative thing that we're moving forward with the budget as recommended for approval by this body?
Good question. My intent was to bring those next month to the annual meeting. I can give you what the update is or was. So it was as you presented it in September, or as you approved it in September, it did go to the municipalities. Since then, at least in the city of Verona and the city of Fitchburg, it starts off with the finance director and the council and the mayor, goes from the finance director, the council, the mayor, and the finance committees. And now, at least in Fitchburg, which is always a few weeks ahead of Verona, this year they're actually fairly close, but it is now up into the packets. So with part of those discussions with mayors, finance directors, city administrators, the proposed peak time staffing request has made it into those budgets. So it was trying to get the challenge every year of getting all three municipalities to move in the same direction at the same time, but somebody's got to go first. So based on all two of the three and now all three of them, the peak time staffing was added. So that was added actually into the operational budget. It's not now two separate documents, which changed the ultimate budget that you saw, because that is now in there under salaries and the applicable line items. Second part of that is to take advantage of the tax levy limits, which we've taken advantage of for the last 3 years, that the peak time staffing was not quite all the way up to the 4.69% base CPI plus the 2% was a 4.69% increase, and I think we were at 3 point something. So adding more hours to that peak time staffing would have exceeded the tax levy limit and not an option. So as has been done in the last 3 years, where they've put, the municipalities have put funds into our reserve funding, which is now at the 35%, as we talked about this spring, there was an additional, I want to say $20,000 put into post-retirement health care. So that helps that funding, because we had one big retirement this year. I know of at least 2 more retirements next year. So that was the change in the budget from what you originally saw in September. Had those 2 changes in there. That'll come back to, you'll see that next month. But yes, that is the budget with the 4.69% that was sent to all 3 municipalities. Thanks for bringing that up. I will send you that document tomorrow.
All good. Thank you.
Thanks.
Any other business this evening, as allowed by law? All right, then. May I have a motion to adjourn? So moved. Second?
Second.
All in favor, signify by saying aye.
Aye.
Aye. Anyone opposed? Meeting adjourned at 7:32. Thank you.